Participation.
Should we get a credit then?
Audience participation is at an all-time high.
Yes. Alright, hello everybody. I'm Sean Bandy and I'll be showing you sleep studies. Feel free to fall asleep during this presentation since that is what it's about. So to start, sleep studies is a diagnostic study, well, pretty much self-implied, about how people sleep and disorders. It can follow from insomnia, FFI, which is fatal female insomnia, which can kill you because you don't sleep. And pretty much, when you're in a sleep study, they just hook you up all these wires. There's usually 42 wires covering from your head, your legs, and your stomach, sometimes your arm, depending on type. And unfortunately, that is how it looks. You look exactly like that, and you're supposed to get calm. It is also used for psychology, for researching your brain, but since we're in a medical class, we're not going to be looking at that. These are some of the types of tests which I found interesting. The nocturnal polysomnogram is the most common. It usually helps you find for sleep apnea, insomnia, and just abnormal sleep cycles, which they can fix, which is awesome. And going down, it's just how common it is. The very bottom one, which is my favorite, the REM behavior disorder, helps deal with people who act out their dreams. So imagine just being in a horrible nightmare and then you automatically act it out and run away. That's how they help. The personnel for the sleep studies, which is usually done in a sleep center next to a hotel, since it's very expensive to make custom rooms in a hospital, is going to be the sleep center manager, polysomnograph technologist, polysomnograph technician, and the medical assistant. To start with the sleep center manager, they get paid about $82,000, and it's primarily just like any other manager job. You oversee the facility, make sure everything is running correctly, all the tests are being done, staff is being paid, you're getting quality staff in, and just making sure everything goes correctly. The education you need to be a sleep study manager is you need a bachelor's degree in financing, the PSAG educational program with about 2 years experience is probably the fastest way to get into it. The polysomnograph technologist is the highest scientist going to be at the facility. Their education is, how do I say, there's many ways to get into it. The education, they showed 3 different types. You can complete a credible technologist program and get some experience going into like a being a tech, just at a sleep study center. You have to be registered from a polysomnograph technologist or a sleep disorder specialist. Those are all tests you can take at a hospital or I can't find the word, college. Hey, don't laugh. I'm running low on sleep for this thing. They are responsible for overseeing all of the other technicians. Sorry, a technologist technician gets stuck in my mouth quite easily. And they're also in charge of doing the higher end tests that the doctors prescribe for their patients, which also includes adding on the electrodes to them, setting the parameters so that when they're doing a pressure pathway, what is it called? The RPD test, they will actually hook on a mask to your face to put pressurized air into your lungs to help with your apnea and insomnia in some cases. The polysomnograph technician makes a little bit less, $46,000. They have a lot easier job getting into it. You have to complete a sleep technologist program, have a 6-month experience as a sleep trainee, which you can get at a sleep center, or just hold a polysomnograph tech credential or anything equivalent to that. They are the step below the technologist, so they apply the electrodes to the patients, monitor them while they're sleeping, just collect the data. They're kind of the main force of the center. Just run around and do as they're told from the technologist. And at the bottom, you got the medical assistant. They say they get paid about $31,000, but they also can be graduates and not get paid anything and be pretty much a, how do I say, practicum? I believe that's the word for it. to gain experience to go on to the higher levels. Their education needs to be just a medical assistant program and be certified from the CMS or any equivalent association. They are mainly checking patients in, doing billing information, monitoring equipment, and scheduling appointments for the rest of their patients. And unfortunately, I did not add this into the PowerPoint, but as I said earlier, a lot of the programs in the centers will all be done either next to a hospital or actually at a hotel, because you're trying to keep patients as calm and relaxed as possible, and it's not easy to do in a hospital and with all those wires on them. So it tends to be a hotel room. You'll have half of it hotel room and the other half is just wires, electrodes, and sleeping equipment. And citations. Questions, comments, concerns? Sorry, I went
Everybody
through that
ready
really
to sign
quick.
up?
And I forgot to add this in. You can get paid to do it as a patient. They didn't say any specific amount. It went from everywhere from about 5,000 to I think it was 400,000 if you go for NASA, which I don't recommend. From what I saw on the NASA one, you're gonna have a lot of bed sores and you're gonna have a lot of muscle mass loss. Good.
Thank you.
And now Levi.
Yay.
Unless she wants to come in. I see her hiding behind the window.
Hi.
Hi.
Sorry for the grand entrance.
Do you want to go next or do you want Levi to go?
I'll go next.
All right.
I'm sorry, Levi.
Okay.
I lied.
Unprofessionally did not set an alarm. Kind of everything.
Don't worry, you just missed me babbling.
Doubt that, but. So, Mr. Chair, I wasn't able to send it or share it off of Outlook necessarily.
Okay, we'll figure it out.
Okay, so I brought my laptop.
Okay.
How am I supposed to sign that? During my technological failures. Sure, no problem that. I don't understand.
What?
Technological failures or what's that?
I don't understand. I don't use it ever.
Yeah, that's why I just went through my normal email, because I was like, I know how to do this. But like, that's something I always know how to do I swear I need the power cord, I just can't find it.
Okay, it's still recording.
I'm like, I don't know this. Like, now
I'll just